On this episode of Chiropractical, we're going to tackle a question every one of us has asked ourselves. Why didn't that patient come back? Did you know that nearly 1 in 5 patients will start care and not actually finish? I'm Jon Kec, a chiropractor of 10 plus years. I've seen it, you've seen it, everybody's seen it, and we all know there's really no rhyme or reason to it. Why do 20% of patients not follow through with their treatment plan? To dig in, we're going to be joined by Dr. Tom Ventimiglia. He's a retired chiropractor of nearly 40 years. He maintained private practice and was also the dean of NYCC for almost 15 years. He's helped shape students, treat patients, and has helped numerous patients find not only temporary relief, but lifelong success with chiropractic care. Dr. Tom, welcome to Chiropractical. Thanks for joining us this morning. How are we doing?
I'm doing great. Thank you, John. Thank you very much for having me.
Yeah, absolutely. Glad you're here and ready to jump into, I think, an exciting and frustrating topic for a lot of providers, right? We referenced it before, 1 in 5, around 20% of patients, for reasons we'll discuss today, just don't really follow through with care plans, don't see the success we expect for them from day one. Let's talk about what's going on there. Why don't they stick as patients? Why don't they stick with their care plan, even though we've laid out what we think is the perfect treatment plan for them?
Yeah. I think the key there is we think is perfect for
Absolutely.
them. And
we don't know everything.
it's hard to admit that, but patients are very smart. They're highly educated men and women, and often they also bring perspectives on their lives. Unless we explore them, unless we get to know the patient holistically or from the biopsychosocial aspect, then we've missed an element of who they are. And so then we wonder, well, why aren't you adhering to my plan? It's in your best interest. But what you forgot to ask was, do you have trouble getting here? Do you have trouble following, getting here 3 times a week? Or do you have trouble eating healthy? Because, we talked about you need to adhere to a plan of diet, which I stopped using the word diet and started using the word, you got to start thinking about eating healthy. But I see, you're having trouble with that. Well, doc, it's hard, I work these hours in the family and, I got to grab some pizza on the way home or some fast food or whatever. If we're not thoughtful about that aspect of the patient from a psychosocial aspect, besides the biological, then we've missed an opportunity. And then we say, well, why aren't the patient following my instructions? Well, you don't really know the patient. You didn't take the time to say, hey, tell me a little bit about who you are. What's life like in your world? And that changes everything, because now you build a relationship, a partnership, as opposed to a paternal approach to why aren't you following my instructions? Now I've learned a little bit about you, and I've learned enormously about how I can be part of your journey. The other thing I'm reminded of is that just because the patient says no today doesn't mean that your instructions, your words, your wisdom, your insights didn't resonate with them.
Absolutely.
Maybe that a week later, a month later, and suddenly it's like, doc was right. I'm going to quit eating, or I'm going to quit yada, yada. Or it's time for me to stop smoking, or whatever recommendation is. I'm going to start the exercise plan. But she was absolutely correct. So we assume it didn't happen. So I guess they're non-compliant. Reality of it is we grow at different rates.
It's not the right time.
Yeah, it's not the right time. So
absolutely. Well, let's step that back a little bit. So I think you made a really important point that I want to talk about a little more. You mentioned kind of the biopsychosocial perspective. And I think a lot of times as providers, unconsciously, we take a path of least resistance type approach, right? We want to dive into exactly what brought you here today. How can I affect that? How do we fix that? Here are the things to do. Let's go, right? And I think you bring up a very important point of understanding the person, understanding their situation, understanding what brought them in. It's really a breakdown in communication from the jump that sets us up for failure. So as that patient comes into your office day one, you mentioned things like, transportation issues or family obligations that may play into the decisions they make on a day-to-day basis. how do we approach those questions to make sure we understand that full holistic perspective of what can we really do for this patient? And how do we start that process?
I think we have the tools. Very often, though, we sort of take them and tuck them under the paperwork. For example, we you get the patient intake information. The patient fills out a form in the office, right? That's generally the way it works. Perhaps your assistant will guide them a little. But at the end of the day, then you take that paperwork, you look it over, and you see where you're comfortable. I'm comfortable talking to the patient about this musculoskeletal problem, their symptoms, and oh gosh, I know all about this. Not too sure I understand this thing about them having a little anxiety. Or the patient checked off that they're taking medication for a mental health issue, or the patient checked off a box about not being able to eat healthy or not able to exercise, or they're under stress. We said, okay, I'm not prepared to discuss this with the patient, so I'm not
Okay.
going to concern myself with it. And yet, that whole patient that's presenting in front of all of those things are contributing to the symptomatic picture that's there. So number one is, are we using the tools we have? Another one that I found very valuable in practice was the informed consent form. We think of this as just some sort of a legal issue. Here's the thing, yes, no, answer the questions, filed away. That informed consent form, if you take just 2 minutes with your patient and ask the open-ended question, did you understand, not your receptionist, not your assistant, you,
You
doctor,
yourself.
did you take, are there any questions about this form? Did you understand what we're going to be doing today? In other words, you start talking to the patient like a fellow traveler
Okay.
and asking open-ended questions so the patient can respond and then just listen. Making sure that your communications to the point that you made earlier is communication that's open and guiding and empowers the patient, as opposed to just fits into your nice, neat package about how I'm going to get this job done. So get to know the patient, use the tools you have, and improve your communication skills.
Okay.
Those are the areas that I think drive a more uh, healing relationship with you and the patient.
And I think that really does help with things like buy-in too, right? Because I think a lot of the reason patients fall off is they don't feel empowered, they don't understand, or they just don't make it a priority. Well, how do you fix a lot of that? You help them understand and you get them to buy into the next step of the process. If you're having that open-ended conversation, giving them the chance to talk about more than just their back pain, you give them the chance to understand, which gives them the opportunity to truly buy in and then be successful.
Yeah, I think that's the key there is that you allow them to explain who they are and then you listen. So what you're essentially doing is you're giving validity to their voice. You may be the only person on the planet Earth that's listening, and if that's part of the healing process, then my gosh, then yes, yeah, I'm going to listen to you. It's going to take all of about 3 minutes, by the way. And if we're talking about what to do to help the patient and not talking about some other information like, the sporting events or set your mind on listening to the patient. That's number one.
Okay.
Allow the voices of the patient to resonate, not your voice, the patient's voice. And then the second thing is the word that you hit on, key concept, empowerment. That that is something that I felt resonated with me in chiropractic, and I understood that to be who we are, what we do, um, from a philosophical standpoint. Which some people say, well, it's just it's just academic. No, no, it's not academic. It's actually applicable to who you are and how you engage your patient. For example, when your patient is not motivated or they're not following your instructions because they have a language issue or they're misunderstanding you or they don't trust you or they don't trust healthcare professionals. They're there because their wife or their husband said, you got to go. But they come from a world where, the medical profession was part of an oppressive regime. We live in a multicultural world. how do we empower the patient? Well, part of it is to acknowledge what empowers a patient. And why do we want to empower them? We want them to heal. And as chiropractors, we embrace this premise, this innate ability to self-heal. How do I empower you to facilitate your innate ability to heal? Well,
Okay.
how do I empower you? Well, empowerment comes from three levels. At least this is what my reading in the literature shows. It's self-confidence. So how do I build your self-confidence? Look, you can do that. Yeah, you can do that. You'll be fine. You'll be do that. I know you feel like you can't move. Here, I'll show you you can do. So we begin to empower the patient by allowing them to know that they have the ability, self-knowledge. Then we have this other thing about empowerment is well, how do we get the patient to get a better sense of confidence? So I'm building confidence. I'm building their knowledge of who they are and their body and how their body works. I'm making them more self-aware. Those are the three elements of empowerment. And so now I've got a patient that I'm listening to who's more inclined to listen to me. I've got a patient who I have this, we're on the same path, healing, getting you to heal. And I've allowed you to be, I'm the guide, you're in control.
But I think there is a lot kind of to that earlier conversation of we have those successes and the successes feel great. And I think there's a struggle sometimes to quantify why, right? What about that was so different? What about that was so empowering for us that this 1 in 5 isn't? What am I missing, right? And I think that's a great way to explain it. It's that symbiotic give and take of that empowerment, right? We feel like we're accomplishing our goals as they feel like they're accomplishing theirs.
Yeah, that's a great question. Why are we missing the boat on the majority of the patients? And so when we look at the reasons why patients don't follow what we believe to be the best interest, they're by and large, a majority of them are psychosocial. They're not biological. In fact, when the patient's in the acute state, they'll do whatever you want them to do. You know, whatever. Yes, just help me, doc. And then suddenly they're moving into a different stage of the healing process. And now the reality of the disease illness models come into play. Well, the disease is something you told them they have, and you're going to fix that. But the illness is starting to creep in like, oh my gosh, this is going to cost X amount of dollars. Or, oh, do I feed my family or do I give the doc his co-pays? Oh, or how do I exactly get there? Because I work until 5, I can't take any more time off to get to the office. So the relationship, when you have tapped into this patient's relationships and you understand the illness as well as the disease, then you see the success rates go higher and higher. So tapping into the psychosocial aspect of your patient, I think raises the potential for you to have a greater sense of accomplishment.
We kind of address communication, tapping into that psychosocial side of things. So we've had a good conversation. We understand the patient now. How do we deliver a successful package back to them that accounts for those kind of things? What do we need to look at, address, and balance as part of that treatment plan? And then that goal and expectation setting moving forward.
Well, those are two key words, goal and expectation. There's a great concept that's about, and me being egocentric, I thought it was a chiropractic, but it turned out to be more of a universal concept.
We can claim it. It's okay.
It's called the SMART goals. They apply to every aspect, whether it's in leadership or in business or in patient care. If I want the patient to move down a path of healing and adhering to what I know is in their best interest, then I need to help them set small goals. What small step can you take? So, by example, what small step can you take that will reduce your use of tobacco? Okay. I'm not telling you this. I know you know you got to stop smoking. Your wife told you. Your husband told you. Your kids are telling you got to stop. But geez, doc, I don't know. Because if you stop smoking, it's a funny thing that's going to happen. Not only are you going to have a better sense of health and well-being, and your future is much brighter, but also it's going to help you with the spine pain that you have because you're not exercising because you're smoking. And when you smoke, you're poisoning your body, and your tissue doesn't know what to do with all this poison. So instead of having good, clean oxygen, your muscles are tightening. There is a biological relationship. So now, how do I get you to make a small step, a small goal? What small step can you take? Open-ended question. Smart goals. So tell me, Mary, what small step can you take? Well, maybe, Doc, I could leave the cigarettes in the car at night. Oh, great. Instead of
Absolutely.
smoking in the house, I wouldn't. That's a great idea, Mary. You know what? Do you think you could do that for about a week? Uh, yeah, Doc, I could do that for about a week. Sure. So let me see if I understand reflective listening. Okay. So
Okay.
we're gonna try and wean off the tobacco use because you already know this is not such a great idea and your kids aren't. And you think you could take a small step by not smoking in the house at night, and you're going to do that for about a week. Does that sound about right? Okay, yeah, yeah, Doc, I can do this. Great. Okay, back on the table, adjust the
Yep.
patient. That took about 3 minutes, right? Because I hear a lot
Yeah.
of our colleagues say, Doc, I don't have
Not
time
at a
for all.
time.
Oh, yeah, but you do. You just have to focus your attention on what you're speaking about. Then here's the secret. Finish the adjustment. See you next Thursday. Great. By the way, Mary, do you mind if we have this conversation about smoking the next time I see you? You're asking permission to continue the conversation. So, what an empowering experience. I validated the patient. She's given me the goals that she can do. She has a plan. It's measurable. It's only 1 week. It's timely. It's relevant. These are the acronyms for the SMART goals. So that's how we move the patient towards a towards goal, which is healing,
Yeah.
helping them heal,
Yeah.
facilitating their healing process. And there are tools. And again, this is a great book. If I may show it to you, this is a motivational interview.
Okay.
Uh, I don't know if you're familiar with it. It's called Motivational Interviewing in Healthcare, Helping Patients Change Behavior by Rolnick, Miller, and Butler. It changed the way I addressed the psychosocial aspects. It changed the way I communicated with patients, and it changed the outcome. And most important, have to be part of who we are and who they are. Not
Sure.
just you're not following my instructions. I'm pretty much moving on to the next page, and that helps us heal.
Every step along that journey is one patient interaction, right? It's a good day, it's a bad day, it's a good treatment, it's a bad treatment. It keeps building us to that next patient encounter and along that journey for sure.
We have expectations for ourselves.
Hmm.
The patients aren't meeting our expectations. It's like it's not on us. We're
Yeah.
not. It's not. That's them. It's not us. But
Yeah.
but funny thing that I've learned after practicing many years is what you do and how you render care to a patient. Maybe you never see the patient again. They only follow up 3 visits, but all of a sudden somebody walks in your office and says, "Hey, Harry so and so referred me, and he said you're the best chiropractor you haven't seen." And you think, God, Harry so and so, I haven't seen Harry in years. And then you think he said that you're great, and he feels wonderful. You don't. And I thought to myself, I really don't appreciate how I can influence people's lives because I have expectations of measuring it as a now. But this is a lifetime. And so you go, oh, I changed Harry's life. And Harry now thought so much of me that he put his, seal of approval to send this new person to me. So the bottom line is you never know how you impact patients' lives, but if your intention and your purpose is always for their benefit, you're in for an overwhelming experience as a doctor, and I think a positive outcome for the people that you serve.
Yeah, absolutely. I think maybe intentionally you brought that whole thing full circle and I love it because that that idea of you don't know how much you can impact a person's life is huge, but we have to go back to where we started. Communication. How do we make sure that we have correct expectations, right? Patients may not be meeting our expectations, but they have no idea unless we've told them what we expect. Where do we expect you to be in 3 visits, 3 months, that is 6 months, a year down the line? And just like we don't often understand their expectations, right? Where do they expect to be in 3 visits, 3 months, 6 months down the line? And if those aren't clearly communicated, everything breaks down from the start.
Yep. Well said.
Absolutely.
Well said.
Hey, I don't think I could have said that 20 minutes ago. I appreciate the conversation to get me there, but
I'm happy to
well,
have been here.
absolutely. Absolutely. I very much love this conversation. Anything else that we haven't touched on? I think there's other parts of healthcare that maybe, or our day-to-day in healthcare, I should say, we haven't really looked at, like roles of technology. You mentioned earlier to me an ever changing knowledge base, we'll call it, for our patients, right? They have so many more resources available. How does that play into that piece of expectation and understanding?
Boy, is that a good, timely question, because we have a new member sitting, a new person or a new element or sitting in, or new energy field sitting in the consultation room with you and in the treatment, and that's artificial intelligence. And that entity exists in your office because the patient, you say to the patient, listen, you have spinal stenosis. And then you explain, hopefully, in layman's terms. Patient
Mm-hmm.
goes back and Googles spinal stenosis. Well, now they're going to get information, and that information is communicated to them, and you communicated something to them about spinal stenosis or spinal spondylolisthesis, and then they read something that's different. Now, how do we reconcile? Well, that I think is part of the 21st century doctoring. Not only the ethical issues, but the fact that communication is no longer just one individual talking to another. There's a third entity in the room. To be conscious of the concept of hallucinations. It's a great word. It sort of resonates, right? The AI system is creating a response, and that response sometimes is constructed
Mm-hmm.
by information that is not valid. So if you're going to depend on AI, and I'm not saying that we shouldn't because it's a tool, we need to make sure the patient understands that they're just getting information from an algorithm that's producing and then concludes something on its own that's not necessarily true. So you need to be a part of your communication skills, and part of how I speak with my patients is to soften that element of the resource and put it
Mm-hmm.
into perspective. But the only way to do that is to make sure that ask the patient,
Yeah.
did you check it out? How can, what did you get that? That's a great idea, but let me share this with you, okay? And the second part of it is you are still responsible.
Absolutely.
The artificial intelligence and the people who created are not liable because they're not considered a medical tool or medical
Mm-hmm.
instrument. So here we have the communications. It's bringing in elements from artificial intelligence. It's influencing your role in communication to get that patient on track to be in the healing process. And there may be misinformation, and they're also not an authority. So it's better for you, or it's best for you to address it from the beginning. Ask the question. But again, if you don't ask the question because you don't know.
Absolutely.
So that's my take on how to address contemporary communication skills.
I think that's a very poignant place for us to kind of leave off, right? We've talked through a host of things, from communication with patients to understanding to empathy. I think we didn't really dive into it. We touched on it. And again, I think the big takeaways here for me: communication, understanding, and remembering that it's not just back pain, shoulder pain, neck pain. There's so much more to that person sitting in front of you. Dig into that, dive into that, understand them, or they're going to be that 20%. They are going to be the ones that do not come back, and you don't know why.
Yeah, well said. Yes, absolutely.
Tom, thank you so much for the time today. Thank you very, very much for everything you've done in the chiropractic profession. I didn't even touch on this, but your time at NYCC and every student you've touched along the way, I'm sure they appreciate it as much as I do. So thank you again.
Thank you very much, John. Have a good day.
Thank you again, Dr. Tom. And now to our listeners, what are you going to do to address that 20% of patients that may not be back tomorrow? From today, maybe it's reframing a few things, going from compliance to a relationship of adherence. How do we empower that patient? What can we do to make sure our communication meets them where they need to be met. Take that back to your office. Tell us how it's going. Let us know those success stories that you've had. And remember, if there's ever anything we can do for you, show ideas, questions we can answer, you can reach us at askncmic@ncmic.com. And you can always watch these episodes on YouTube at our NCMIC YouTube channel. I'm Jon Kec, and this has been Chiropractical.